I chose to start the Hydroxyurea regimen because he was in the hospital constantly, month after month.
I started because last year in March, I came down with acute chest syndrome. And for any persons living with sickle cell disease, you know that acute chest syndrome is very, very, very scary.
My child, Travarius, has been taking Hydroxyurea for about 1.5 years now. I choose to start it because they gave me some information about it, so I researched it a bit more, and then once I finished researching it and I found out that it was going to be better for him, I decided to take a chance on it. I'm glad I did.
My son has been on Hydroxyurea for about 10, 13 years.
For us, as young parents, not knowing what's going on with our child and him always in the hospital hurting until we came across the Hydroxyurea, and it's definitely, like I said, decreased the amount of crisis dramatically, and it's kind of like a miracle almost.
Hydroxyurea has allowed me to keep my business. I have been out of the hospital and healthy since July of last year. It has been wonderful. I feel like I've gained some sense of normalcy with my life.
It's actually helped me with school a lot, especially school. I've been there every day with my attendance record intact, no absences whatsoever, and I haven't been coming to the ER not once this year, not once.
Well, taking Hydroxyurea has really impacted my child because he's not as sick as he used to be. We don't have as many emergency visits as we was, and he's a little bit more alert than what he used to be.
I would definitely recommend Hydroxyurea to other patients and families with sickle cell disease because it has worked wonders for our child. Since been on it, it decreased the amount of crisis dramatically.
I am the biggest advocate for this medicine because of how it's changed my life. I feel that people who are like myself or anyone who does not want to be in pain all the time and who cherishes a normal, quote unquote, normal life, they want to keep that life and make it as normal as possible. And Hydroxyurea has helped me do that, so I recommend it to everyone. I strongly recommend Hydroxyurea to everyone.
The one thing I would want families to take away from possibly using Hydroxyurea is that if you're a working parent or you're going to school or anything like that, with this medication, you really don't have to, worry about every month going back and forth to the hospital.
If you want to get good results out of this, it requires consistency. That means just, you'd have to take it every day, no exceptions.
To not be afraid. Of course, everyone is different, and why not give it a shot? Because if it can change your life like it changed mine, and I know it changed many others, why not try something that has that kind of healing power?
Hydroxyurea has been a medication that really has changed the course of individuals, particularly children with this disease.
We didn't have that as a child coming up, so that's a great progress.
Hydroxyurea has become the mainstay of treatment for children and adults with sickle cell anemia. At our center, we have made it standard care to introduce the drug and really encourage our families to start the treatment by at least 5 years of age.
She takes folic acid and Hydroxyurea.
He started it about when he was 5.
So she's been doing real good, no hospital visits, which is, thank God.
We used to tease and say he was kind of the poster boy because he was on the lowest dose and he's never had a major crisis.
And we've seen a dramatic improvement in the quality of their life, decrease in pain episodes, decrease in anticipated acute chest syndrome episodes, and the decrease in the need for blood transfusion therapy.
When we moved up to Nashville 3 years ago, he was having more than 3 crises in a year, and now they are down to 1 sickle cell crisis.
Most importantly is that we see improvement in the overall quality of life of our children on this medication. And now we have adolescents participating in high school activities that a decade ago I had never seen before.
Let's go.
Ask me why.
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 Ask me why. Ask me why what? Why am I taking hydroxyurea?
Ask me why. Ask me why I think that you should use hydroxyurea to treat your sickle cell disease.
Hydroxyurea has been very beneficial for my sickle cell. I've been on it for about 10 years now, and it's helped me a lot.
So why not? I'm going to introduce you to a group of people who either have sickle cell disease or have a lot of experience treating patients with sickle cell disease and the use of hydroxyurea for this illness. So I want you to listen to what they have to say and think to yourself, why not hydroxyurea for sickle cell disease?
I've been on hydroxyurea for 2.5 years. In the time that I've been on it, it has reduced the number of hospitalizations that I've had. It's reduced the intensity of my crisis, and it's reduced the number of times I've had to go to the day clinic. And on top of that, when I went to my regular primary physician, she was really excited when she saw that my blood work was really, really good.
Sickle cell is my enemy. It's tried to kill me in the past more than one occasion. I've had 2 strokes and a seizure that I'm very lucky to have survived. So when you ask me why I take hydroxyurea, ask me why not. Why not take hydroxyurea for sickle cell disease?
At this time, hydroxyurea is the only disease-modifying medication that we have to manage sickle cell disease. Every day I see the many complications our patients experience. Then on the other side, I've seen the tremendous decrease of these complications as well. Hydroxyurea has improved the quality of life of the families we serve. Ask me why not hydroxyurea for sickle cell disease.
Ask me why.
Why what?
I should take hydroxyurea for sickle cell.
Well, tell me why.
Because I feel much better. I've been able to do a lot of work around the house. So basically, I think that's really been helping. The hydroxyurea has been really helping.
And so, yeah, if that's all great, why not?
Why not? Yeah, why not take it? Like sickle cell patients should really take it.
Ask me why not hydroxyurea for sickle cell disease.
Ask me why I think our clients with sickle cell disease should try hydroxyurea.
Hydroxyurea for sickle cell disease. You should be on it.
I think I will talk to my physician about hydroxyurea. It's very beneficial. Why not hydroxyurea? Why not for sickle cell?
Ask me why!
I've lived with sickle cell my whole life. I've never known anything else. I have sickle cell disease. I have SS. That's the most severe form of sickle cell disease. So I was afraid to take it, but I thought it wouldn't hurt to try it. So I started taking hydroxyurea in May 2009, and it has really changed my life. I haven't had an admission in 13 months, and it's my numbers, my blood numbers are wonderful. My doctor is totally pleased with it. I haven't had any negative side effect from the medicine. It's really wonderful. It's been good to me.
Since Nicholas has started taking hydroxyurea, he's been able to be more active.
Hydroxyurea changed my life. I can stay home for months at a time now. I'd be in the hospital all the time when I was a kid, so now being able to stay at home and have like a regular schedule with sports and, you know, school and friends.
Pretty much everything is under control because of hydroxyurea.
The amount of pain crisis that I've had before I was taking hydroxyurea was a lot. That's all I can say. It was a lot. Now compared to the time that I have been taking hydroxy, very, very minimal. I mean, I made like last month, a month before last, I did have a crisis that I had to come to the emergency room with. But that's been almost 4 or 5 months that I have not had a crisis. You know, not a substantial one where that I would have had to wind up coming in the emergency room. So I would say very, very slim crisis that I've been having.
Hydroxyurea has affected my work, my schooling especially, because it has allowed me to feel like, you know, I can take an extra class or maybe do this extra lab so that I can get finished as soon as possible, because I don't have to come as often to the doctor for treatments. I maybe come here once every 3 weeks. And so it's allowed me to just have a lot more freedom about my schedule.
My life is just turned around. It's something to have to depend on people to help you and be with you and to be able to be independent. That's a very important thing, that you can do things for yourself and don't have to have people around watching and waiting for something, you know, to happen or whatever.
Hydroxyurea has really did a great, tremendous job. I know for me, I don't know about if any other patients is taking it. I don't miss many time off from work as I used to do.
I would say to someone that's thinking about starting hydroxyurea to give it a lot of thought. And I know like everybody is different, so, but I would give it a lot of thought and give yourself a chance to open up to a new idea that maybe it will benefit you so that you can have a lot more freedom.
When we talk about my family, I'm talking about my sisters and brothers, you know, and they think it's, you know, that's good meds too, because they know mainly when I'm in a crisis, my sisters, you know, is right out here to the emergency room with me. And they notice that I have not been, you know, coming into the emergency room so much. So I think they think, you know, it's a pretty good medicine also. So in fact, I think they love it. They love that I love it as I'm on it. You know, simple as that. Yeah. If you ask one of them, they'll probably say, give him 10 bottles.
I mean, it's not, I don't want anyone to be mistaken that it's going to be a magical cure overnight and you're going to just automatically feel better as soon as it's in your system. And it's not like that, but it's just something that allows you to just feel like a crisis is not right around the corner waiting on you.
I can say that hydroxyurea has improved my life. I've gotten less pain crises. I don't really have to go into the hospital as much.
My life before hydroxyurea, as mentioned before, I had lots of crises in the hospital 2 to 3 times a year, and then it came to the point where I was there like once every month, and also other issues with sickle cell, you know, having more abdominal issues. I had started getting leg ulcers and things like that. But after hydroxyurea, it took a while for it to start working, maybe about 2 years. And then after that 2 years, just all of a sudden, I wasn't having major crises anymore.
Before I started taking the hydroxyurea, I was a regular patient at this hospital. When I say regular patient, I mean, I was in this hospital so much that every nurse knew me, every doctor knew me. They knew me from my childhood on up to me being a 39-year-old man right now. Upon my starting to take the hydroxyurea, my hospitalizations began to decrease. Slowly at first, but then exponentially. I don't think I've had a crisis now in the past 3 to 6 years.
I became a mother, a wife, and dealing with everyday stresses. I had started having more crises frequently. It was to the point I was having them maybe like every month. I was in the hospital every month. So I was missing out time with my new baby, and something had to be done. So I just said the heck with it and decided to try it, and thank God I did, and it has changed my life.
I just think that if you can do anything to improve your life, you know, you get one life to live. And I think you should do everything you can to improve it and do the best you can with what, for me, with what God is giving you while you're here. And for me, God has given me Hydroxyurea.